Hello, welcome back. This is Dr. Marc DuPéré, plastic surgeon at the Visage Clinic here in Toronto, Canada. Visage means face in French, so we do a lot of facelift surgery in Toronto in my clinic. This is what my extra training was in Paris and in Los Angeles. Now, we've started already the procedure. I just thought I would pause for a minute to explain a few interesting little nuance that we are doing today. This is a patient of mine from roughly 10 years ago. We did a facelift, deep plane at the time, smash lift, skin lift, fat grafting. Today when she showed up to my clinic a little while ago, she had early recurrence of jowling. She was not bad, but she likes to look her best at all times. So she had a bit of a recurrence of the jowling, of the marionette line, very, very soft returning of the neck bands. She still had nice volume in her cheek, but lacking a little bit on the arch. So we've already done fat grafting this morning, not to the medial or inner cheek, but to the outer part. It's slightly exaggerated because half of it goes away. I did some fat grafting to her laugh line, marionette line, and pre-jaw depression, because even when we lift, there's always a hint of a depression here, a shadow, shadow, shadow. So fat grafting helps to make your facelift look better and last longer. Now, if you come here, an important principle is to not age the patient also on the side with your technique. So in the previous facelift we did, a deep plane facelift, the incision was into the scalp area. That's a very classic incision from the old days. Now, she had low sideburn. So when I did this by lifting, the sideburn went up a little bit, still healthy looking. We like it at least at the height of the base of the ear. But now if I'm going to redo that incision here, I'm going to lift and cut skin away. This sideburn will ride up and back, which will age her and masculinize her. So we don't want to do that, obviously. So the Brazilian, long time ago, came up with the idea of a peninsula technique. We won't do a full peninsula, but I'm going to bring my incision under the sideburn so that when I lift this and cut the excess of skin, this will not move. This will stay there, will remain youthful and feminine. So it's very important to adjust your incision depending on the sideburn of the patient. Still 50-60% of our ladies, first facelift, we need to do that. All male, we need to do that because of the sideburns. And most secondary facelift, we have to do that. So that's a very important nuance. I want to show you her scar, how well she healed. And the scar has remained behind her tragus, inside the ear canal, which is lovely to keep it there. It's a sign of a better plastic surgery procedure, and it will remove any straight line in front of the ear. And it's nice when the scar stays behind the earlobe. So it's important to close this with no tension, because I see a lot of old facelift, the incision have kind of come forward in the healing phase. Now for her upper lids, this was done in Mexico 1 year ago. When she came to me, she still had an excess of skin and she still had bulging. I don't know who she saw, but lots of surgeons don't like to remove fat pads. It's important to be conservative in the central one, but the inner one, we should remove it because it's still bulging even when she stands. So I remove a very small amount, few millimeter of skin around her scar. Her scar was high, it was at 11 millimeter. We like to have it at 9 millimeter above the lid lash. So I brought this in a tiny bit. And I will remove conservatively some fat pads to make it look nice, rejuvenated with a crisp upper lid. Hello, welcome back. This is part 2 and last part of our secondary facelift, tertiary upper lid surgery with fat grafting, neck lift, platysmaplasty. So this is a lady, patient of mine. I've been in practice for 25 years now in Toronto. So I am seeing secondary procedures. We did a facelift many years ago. We redid a facelift today using the deep plane layers as the Kris Jenner technique. This is something we do in Toronto too for many years. I've used her previous scars. Now the slight nuance here is I had to do a sideburn incision. I had to follow where her hair was, slightly on the high side, but this is important to do an incision in the front here to avoid moving the sideburns higher. That would age her. We did some fat grafting, very small amount, some to her zygomatic arch, not to the inner cheek. She was happy with the volume she had that we did many years ago. We did a touch-up fat grafting to zygomatic arch, temple, laugh line, marionette line, and jawline. You can see that beautiful line that we were able to obtain with a combination of the deep plane facelift, skin lift, neck lipo, and this platysmoplasty here. You can see how snatched that neck is, how beautiful that angle here is. Very 90 degrees with liposuction, muscle repair, and removal of deep neck tissue. We redid her upper lids, slightly longer than usual because she had it done again or redone a year ago in Mexico. So I followed her old scar, removed a small amount of skin, removed the fat pads that I believe were not removed in Mexico that bothered her. So this is a 6-ish hour procedure. I keep all my patients overnight with overnight supervision. I use drains for the night. They will be removed tomorrow morning. And I want to thank my patient for agreeing to this filming. Thank you for watching.